Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. Well, we have a special request here. The programming team at This Week in Health IT would like to highlight solutions that deliver hard dollar savings to healthcare in under 12 months. This is in direct response to comments we're hearing on the show, as well as comments I'm hearing in my consulting practice. Before you drop me an email, I need solutions that have successful client stories. I receive about 10 emails a week from companies that want to highlight their product on the show. And my first question is always, put me in touch with a reference client. And amazingly, about 90% of those requests fall away, which I find really interesting. We want to see what kind of response we get from you guys, and then we will determine how we're going to, get this integrated into our programming and get it out there. So, send in your responses. Bill at thisweekinhealthit.com. Love to hear from you. Love to hear what you guys are doing that is showing hard dollar savings, real money savings for healthcare. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that's how we've been able to produce daily shows. It's just a special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. All right, this morning we are joined by Mike Pfeffer, Dr. Mike Pfeffer, the CIO for UCLA Medical Center. Good morning, Mike. Welcome to the show.
Thank you so much, Bill. It's great being back since our last discussion.
Yeah, our last discussion in face-to-face, in person at a conference. I look forward to doing that again sometime. I'm not sure when that's going to happen, but and by the way, thank you for taking the time. I know this is a extremely busy time for everybody, so thanks for taking the time to join me.
Yeah, my pleasure. This is an exciting day, actually, at UCLA because it's our medical school graduation, and it will be all virtual. So first time ever virtually, and big shout out to the IT organization, especially the AV department and our content team for being able to put this together. It's a new world when you're doing medical school graduations virtually.
Yeah. How are you making it special? I mean, what does it look? I'm just more curious than anything.
Yeah. Well, it's really about making sure the graduates feel that this is a special time for them, and a lot of work has gone into graphics and how we're going to present the different speakers, and then acknowledging each one of the graduates, having their names read, and then kind of taking that and taking the graduates' kind of responses to the graduation and putting all that together. It's different. We'll see how it goes, but overall, I'm really excited that we're able to provide something for them, because it's truly an extraordinary achievement to graduate medical school.
Yeah, absolutely. I mean, graduate from UCLA Medical School, that's an amazing deal. I know that, my daughter goes to Baylor. She's a freshman at Baylor, and she got a survey, and she was telling us about it last night. And then I, as a parent, got a survey today, and it's really extensive. I mean, because they're talking about coming back to campus in the fall, and they talk about, do you want to, or how do you feel about a 14-day quarantine when you come in? How do you feel about staying the whole semester instead of coming home for Thanksgiving and those kind of things? If you do go home at Thanksgiving, how do you feel about taking the remainder of your course online? How do you feel about taking classes on a Saturday? I mean, this is really a new world we're living in, where you have to think through a lot of things that we didn't think about before. It's amazing.
Mm-hmm. It is amazing. It really is.
All right. Well, let's jump into. I'd love to hear what's going on there. Give us an idea of how the health system experienced the pandemic thus far.
Sure. So UCLA Health basically did what a lot of other organizations like ours did, and that was get ready for a potential surge. So that means, making sure we have capacity in our facilities, making sure we have the appropriate equipment for our providers, like protective equipment, ventilators for patients that need it, and then all the ability for us to provide care to people virtually, because COVID doesn't negate everybody's chronic medical conditions that need care or preventative care measures. So we need to make sure that we can provide all that the best we can. So really ramping up our virtual video visits. We went from 400 a month to 80,000 in the month of April. So that's somewhat of a significant increase, but it really allows our physicians to connect with our patients. And that's really, really important. So, a lot of work on just ensuring that we're ready, we're prepared, that we're doing research on the topic. And so all that's kind of still going on.
That's amazing. So I'm going to focus in on a handful of those topics that you just brought up. Because we've seen amazing gains, as you noted, in telehealth, in a lot of different modalities. And really other digital tools as well. Remote patient monitoring, chatbots, and other things have been sort of inserted into the process. How do you think that stuff is going to be integrated into our post-pandemic work models?
Yeah, I think all of this was going to happen, and the pandemic accelerated it completely. And so, people ask me, well, how could you go from 400 video visits to 80,000 video visits? How do you have that ability to do that? And I usually say that, we''ve been preparing for this as an IT organization for years, right? We've put in all the infrastructure, we've put in all the processes, we've tested, we were ready to scale. Obviously, we weren't preparing, thinking we'd be scaling at that rate, but we were really ready for this. And sure enough, we were able to, scale at that rate. And again, I think all of these things that we've put in place, real expansion of telehealth, chatbots on websites, online scheduling, all of those things were coming, if not already here in some aspects. So I think it's just an acceleration of the digital patient experience, and I'm very, very excited about where it's going to go.
Yeah, it's interesting that you say we've been preparing for this for a long time. We really have. I mean, we've been talking about telehealth and its ability to really improve access, quality, satisfaction for a long time. Talk about work from home a little bit. So, how have you experienced work from home, and what do you anticipate the future will be for your specific health system?
Yeah, so the IT organization actually began remote work or telework about 5 years ago. And that really had to do with the fact that traffic in Los Angeles could make a 5-mile commute into an hour and a half. And so to have a balance for the employees in IT to be able to do the detailed work they need to do, as well as maintain relationships, we had a hybrid model. So you would either, depending on your role in our organization, you would work 3 days a week from home and 2 days a week in the office, or 4 and 1, or 4 and 1. We did have some parts of our organization that didn't. So desktop support, for example, our call center actually was all in-house as well. We call that customer care. So we've been doing a lot of this for a while, and we really came up with a model, I think, that worked pretty well. It's not perfect, but the idea that you would schedule for your week, not your day. I think a lot of people look at their daily schedule and they say, okay, this is what I have to do today, and I'm going to go do it. But we've really tried to encourage, look at your week. And the reason why that's important is the days that you are at home are the days that you're really kind of have the ability to dive deep into technical or complex tasks. And the days are in the office are really for relationship building, key meetings with your business owners. And so thinking about it as a week instead of a day, I think, has been really instrumental. Now, in COVID, we've gone to kind of what we're referring to as fully remote, with on-premise as needed. So if you need to come in and do something, whether it's in the hospital or in one of the clinics, something's broken, we need to be on site for something, there's a key area, then you come in for that particular thing. But otherwise, right now, the IT organization is working fully remote.
So do you think you're post-pandemic, you think you'll go back to the 4-1 or the 3-2 model, or do you think that will change at all, or do you think you'll just go back to that?
Yeah, it's a good question. We're working through that. And actually, kind of the way we've been thinking through this is getting everybody in the IT organization to weigh in. So we actually had a work stream. So we asked about 10 people to get together and think through what is it going to look like in the future. And then taking that product of work, we've then allowed the entire IT organization to comment, read it, and give us their suggestions. And so our plan is we're working through that. We're coordinating with UCLA Health as a whole, right? Because we need to also comply with what the organization is going to do. And then we're looking at what's going on in LA County with the virus as well. So kind of bringing all those things together will determine what we look like. In the meantime, we're going to be staying remote until mid-September. And then we'll see what happens. I think a vaccine is going to be critical to really understanding what the future is going to look like. And I was just reading a recent study that suggested that immunity may not be as long as we think. And so that's another challenge when you're looking at, if you get COVID, are you immune to it forever or for a while? And the answer may be no. So that's going to significantly change how we think about this as well.
Yeah, we're figuring things out really as we go, and we're getting new information all the time. It's really interesting. So today is, we'll blow the illusion of the podcast here. Today is May 29th, and the reason I give you the date is I sort of want a snapshot in time of, your priorities. So what are the priorities of health IT today, and have they changed significantly since January 1st, or do you think they'll change significantly towards the end of this year?
Well, I think there's going to be some change. I wouldn't necessarily say significantly in terms of, what we need to provide to the organization. Always stability, reliability, outstanding customer service and support. Those things are just paramount to what we do. I think we're really going to have to look at our portfolios and see what is really necessary, what can be consolidated, what different platforms we can bring together. Are we duplicating things? And really look to, as best as we can, reduce some of our costs around our purchase services. At the same time, providing what the organization needs. So in this challenging time, I think all health systems are grappling with, decreased revenue and uncertainty into the future. But at the same time needs IT more than ever, right? So health IT is even more critical than it's ever been, I think, in enabling the organization to be successful. So it's going to be that balance. We want to be good stewards of the resources that we are, really blessed to have. But at the same time, every dollar that's spent on health IT, right, is a dollar not spent on medical education, medical research, and patient care.
Right.
So it's really focused on, I'll call it strategic finance in health IT.
It's interesting. We have interviewed a bunch of people, and former CFO for UPMC was on, and we did talk about this, that we're really exiting, one crisis, which is the pandemic, and we're entering, for some health systems, which is another crisis, which is a financial one. And nothing is more important at that point than the automation and the capabilities that IT really brings to bear. And I think that's what you're speaking to. But we are seeing signs that, claims data is growing, which means volumes are starting to tick up. That seems to be across the country. What kinds of things is your health system doing as you expand procedures, maybe from a safety standpoint, or new systems that you've put in place from an IT perspective around safety?
Yeah. So, I can't prove this, but I will say that going to a hospital or having a procedure is probably safer than going to your grocery store, right? Because we do everything we can to ensure that our people are safe. So we have an automated symptom tracker that we built that every day prompts our employees to see if they have any symptoms. We have temperature checking for all employees and visitors and patients coming into our facilities. But I really think our main message and goal is really to encourage people who need to have medical care to come in. As an example for elective surgeries, and the word elective is always a challenge because people need their surgeries. Maybe it's not an emergency, but you can only put these things off for so long. We're doing COVID testing 2 days prior to the surgery for all of our patients. So we can ensure that our patients are not concerned that they have it and they're asymptomatic, or our providers that are taking care of them. So that I think has been really successful. But all in all, UCLA Health is practicing state-of-the-art, hygiene and cleaning and use of protective equipment to make sure that we are as safe as possible for our patients.
Yeah, absolutely. So how is, from a health IT standpoint, how are you planning for a second surge? Have you implemented any technologies that will help you to respond quicker if there happens to be a late, a surge at
Sure.
a later time?
Yeah, so I'll break it into 3 areas. So one is analytics. So we built out an incredible amount of analytics on COVID-19, patient flow, all the things that we need to very closely track how things are going on in our health system and the community as we do all of our testing. So we can see all this information. In fact, the UCLA Health COVID testing is actually, we have a dashboard that's public off the UCLA Health website. So you can see how many tests we've done. We actually had that pretty much in the very beginning. But you can see how many patients are currently hospitalized at our facilities and positive and negative in total testing. So it's actually really interesting. So really robust analytics that are helping us determine kind of where we're going and being able to predict. The second is our structural kind of design of our electronic health record to enable what we call shadow beds, so we can quickly expand the amount of beds we have in our facilities to if we need to. So that a lot of work went into building out that infrastructure beyond what we already had. We had some of it in place, but we went really beyond that. And then the third thing is really about continuing to ramp up our telehealth capabilities. One thing we've done, which I think is really amazing for our patients, is we have inpatient iPads for basically every patient. And on those are not only access to the electronic health record, but also they have a Zoom platform and an account assigned to the room, so they can actually video with their families as well as providers. So providers can actually video into the rooms and allows us to check in much more frequently as needed. So kind of all of those technologies in terms of telehealth and expanding our digital patient experience is what we're doing to ensure we're ready for any future surge.
Yeah, sort of the silver lining of this is that all the digital health initiatives we've been talking about for the last 5 years were so accelerated over that time. It's really amazing to hear all the places you guys have integrated. What do you consider the greatest learning at this point from the experience thus far?
I think, one is, and maybe it's not learning, but I knew this kind of all along, how amazing my team is here at UCLA. Both the organization and operations and finance, and all of our groups coming together and align around this pandemic, as well as, of course, the health IT organization, the dedication. It's truly incredible. So maybe not a learning, but just a reaffirmation of that. I think one of the things that is interesting to me about all of this is how impactful rules that are imposed upon health systems can limit technological growth. So, for example, take telehealth. One of the struggles that all of us have been having is how do you interpret all the different rules across all the different insurers, all the different states, CMS, on who can have telehealth visits, video visits, who can't. And with the relaxation of some of those rules and the movement that telehealth or video visits are equally reimbursed compared to an in-person visit has been game-changing and has allowed us to expand this in a really rapid way. And so my hope is that we continue to learn from that and not put these rules in place that really limit how we can take care of our patients in the best way. Had none of those rules been relaxed, I think a lot of organizations would have been in a very difficult situation in terms of expanding their video visit capability, and most importantly, caring for patients that needed it during this pandemic. So to me, that was, I think, really, really interesting. And just seeing like how quickly everybody was able to expand when these rules went away.
Yeah, I think that's really true. I mean, the stories are amazing, right? I mean, you gave your numbers, and we hear people say, we went from 100 to 1,000, or no, it's like tenfold, like 100 to 10,000 in this time last year we did this many in a week. This year we're doing 10,000, and we've seen that across the board. It really is amazing. It's the funding, and then it's the rules. Those are the two things that really just really blew open the doors for telehealth. It's been interesting to watch.
And I think, the next steps are really going to be going back to our researchers to look at what is truly the best use of telehealth. There are absolutely needs for in-person visits, whether it's from a relationship standpoint and getting to know your primary care physician, to having the primary care physician or other specialists be able to do an exam, to procedural, to, there's reasons why you need to come in, and there are great reasons why you don't. And that a video visit would be a great way to perform the visit. One physician commented to me that you can learn so much about a patient when they let you into their home, right? Other family members can be there that normally wouldn't have been there. So, I mean, there's really incredible benefits, and we need to have a very evidence-based approach on when is the best time to use video visits and when is the best time to come in person. But I think the synergy of those things is really going to define healthcare going forward. And I'm really, really excited about that.
Well, Mike, thanks for your time. I really appreciate you coming. By the way, you win the award for the best background. Unbelievable.
Thank you.
How good that looks.
I appreciate that.
Well done. All right. Well, we'll catch up again in the fall. Take care. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, most of you can say this now without me even finishing it. The best way to do that is to share it with a peer. Stop right now, send an email, tell somebody, hey, this is a great show. I'm getting a lot out of it. You're going to want to check out these interviews and conversations. The second best way you can do it is you can subscribe to our YouTube channel. We're putting an awful lot of new stuff out there, and it's exciting. The live show will only be available on the YouTube channel. It will not be dropped into the podcast channel. Some of you asked me to drop it in last time, but my team here internally wants me to stay focused on the strategy, and that is to have content that is specific to YouTube and to start to diversify our channels, if you will. So some of our content will only be available on YouTube. So get over there and subscribe so you know when it's available. Please check back often, as we're going to continue to drop shows on a daily basis through the end of June, or until we get through this pandemic together. Thanks for listening. That's all for now.